we go. Right, okay, morning everybody. Welcome to today's session, SDS Network England, where we're going to be talking about individual service funds in action and hearing some practical lessons from Newcastle Council. My name is Chris Watson. I am the director of SDS Network England, and I also work with an organisation called Self-Directed Futures, where we do bits and bobs of consultancy around the country for councils, ICBs and care providers, with a very strong focus on individual service funds. So today's session, obviously we're going to hear from Marta Czapecki. I think I got that right, Marta. And who's from Commissioning and Procurement at Newcastle City Council, and she's very kindly going to share with us some of their learning from their individual service fund journey that Newcastle have been on over the last couple of years. And then after that, we will have an open Q&A session, which is obviously for people to have a chance to have a chat with Marta and get some tips and guidance. Hopefully, if you're interested in doing this for your council area, there's an opportunity to have a bit of a chat and talk about the challenges and the lessons learned, and then we'll aim to close just before 11 o'clock. So if everybody's okay with that, I always forget to do this, but the SDS network is just so you know, in terms of the context of our network, it's a global movement now. We've got 12 countries now signed up to Self-Directed Support Network globally, which is cool, and got nearly 1,000 members. Yes, 12 national hubs. And we've got Commissioners Network is growing amazingly, and we're really delighted to have you all here. We've got over 300 commissioners now in the network, and we've got over 70 councils, which is amazing, because when I started this journey, there's probably only 2 councils in England that were really interested in ISF, so this is really lovely we're getting towards half the councils in England, which is awesome. And our mission is just to connect good practice, people who want to change systems, innovators, commissioners who want to just shape the future of care in a different way. So I will hand over to Marta to just introduce herself, if that's okay, and then I'll take my slides off Marta after that.
No, I couldn't find unmute button. It's weird, but I'm here. No worries. My name's Marta Czapecki. I'm working for Newcastle City Council as a Commissioning and Procurement Officer, and I have been working in that role for about 10 years now. I'm going to talk to you all today about the journey that Newcastle City Council has made in developing individual service funds as part of our transformation of learning, disability and autism services. I'll talk you through how we started this work, what we've learned through the project that we have run for about 3.5 years, and how this ultimately led to our new learning disability and autism framework arrangements and the commissioning details that we are using in practice today, if that's all right. I will put my presentation on, just bear with me a second. So a bit of a background. Towards the end of about 2015, the council started a piece of work with an organization called Social Finance. It's a non-for-profit organization that works nationally, and it brings together data, innovation and financial insights to tackle complex social issues. We've done that because we have seen an opportunity to apply their expertise to the way we support adults within our learning disabilities and autism cohort in Newcastle. What we wanted to do is to see how we can better use all the data we have, how we can redesign the system, and how we can explore new approaches to funding and change our service delivery model. So what we wanted to do is to understand not just how services are delivered, but how we can actually make a meaningful difference to people's lives within Newcastle boundaries. The collaboration with Social Finance helped us to shift from traditional fixed models of care, and they have relied historically on rigid hours of support or packages that were built around the worst day case scenarios for people. And we wanted to move towards a system that was more personalized and adaptable. We also wanted to improve outcomes for individuals in Newcastle. And there was a bit of an element of significant financial pressures, as you know, within our budgets. So we've tried to combine this all together in some kind of a meaningful way. The core principle of the work was very clear. We wanted to increase and explore support that should be person-centered, creative and flexible. And we understood that people's life change and the support should be changing with them rather than being rigid and in place. One of the biggest shifts that came as part of the work that we've done was outcomes-based commissioning. So instead of commissioning blocks of time, as I mentioned, we began to focus on actual outcomes people wanted to achieve in their day-to-day lives. Social workers reviews within learning disabilities and autism population became more dynamic and responsive, and they were adapting to people's needs, but also more to their goals and aspirations. We also looked at what tools we can use and implement to measure and evidence progress in a consistent and meaningful way. And we've had distance travel tool that encompassed a number of different areas in people's lives. After some work has been done behind the scenes with Social Finance Project, we have created a dedicated Learning Disabilities and Autism Insights project team, which was consisting of initially 5 and then more social workers joined as the time progressed, as well as a data analyst dedicated to the team and a commissioning officer dedicated to the team as well. Our plan was to engage directly with people with learning disabilities and autism, the families, and with support providers to review what we have on the ground and design and deliver a model of care that would be more flexible, more personalized, and generally focused on outcomes. So over the period of 3.5 years, the team carried out outcomes-focused reviews with everyone who we've at the time had on our books within learning disability and autism cohort. And during this process, we also tested and started implementing individual service funds. So we could have bigger flexibility and choice for individuals in the cohort that has been reviewed. Throughout the work that we've done in the 3.5 years of the Insights project, we've built much stronger relationships between local authority and our team, as well as support providers and people who were receiving support. And those relationships, I suppose, helped us to create like a starting point foundation for new commissioning arrangements and for the wide system changes that followed that period. So what have we learned from our Insights work? Firstly, people support needed to be creative, dynamic, and person-centered, and not restricted by fixed hours on inflexible care models. Secondly, outcomes-based commissioning became embedded as normal practice, and we now frame support around goals, progression, and meaningful impact rather than being task and time-oriented. Thirdly, we recognize that support cost must be individually focused and flexible when needed, and the aim was to improve outcomes for people and not to fit people into default packages or descriptions. The fourth is that individual service funds began to emerge as the default option in place of rigid hours of support, because it was helping to achieve better outcomes for people and be more meaningful for them. And finally, we wanted people with learning disabilities, autism, and the families to become members in shaping our change, not just the recipients. So we included them in our co-production going forward. So what we have done after the project ended, all the work that we have done, yeah, of course, we will share the slides as well. It's created the starting point for our new contract arrangements. So our learning disabilities and autism contract was coming to an end, so we've used that experience and the time we've had for procurement preparation to undertake significant market engagement with people and providers. We've had Inclusion North helping us facilitate a number of participation sessions with providers and with people gathering information about how they want the support delivered, what matters to them, and how the providers should be working with people in a more meaningful way. Together with all the partners, we have produced a new service specification, which is centered around outcomes and the use of individual service funds. And ISFs are currently our main way of funding care packages for learning disabilities and autism cohort, unless there's a very good reason not to use them. The work that we've done put together informed the development of our new learning disability and autism framework procurement that started in 2022, and the new contract went live and was put in place in January 2023. So what does it look like in Newcastle? We call it Newcastle model because, as you would know, Chris, every council has a slightly different approach at how we do things. Our current contract arrangement puts ISFs in the middle as a middle option between directly commissioned services and direct payments. What it means that people have much greater flexibility and choice than when they have traditionally commissioned services, and that can change at any time as they want it. But also individuals don't have to take the responsibility of managing their budgets and money as they would do under the direct payment. You can see on screen that our learning disability and autism continuum of support framework covers a number of accommodation-based and community-based support, from outreach through supported living, shared lives, up to community clusters, which are our most complex services. Day opportunities and residential care sit outside of the framework, and we have two quite specific settings called Allendale Court and Holmes Close. The first is a step down service for people coming out of residential care and young people to prepare them for moving into the community or coming back from out of area. And Holmes Close is a bungalow-based setting for people with learning disability and autism who are over 55 and also have physical disabilities, so it's slightly different offer to meet their needs. And the commissioning arrangements. Under the new framework, we don't have brokerage function as such, so ISF providers also work directly with individuals to build the support. They can provide the support, and they can also manage any alternative support that people would like to use. We have a framework of approved providers that manage ISFs, and we reopen the framework every year for new providers to be able to join. We also use core cost models for some of our supported living, where we pay the provider core cost regardless of the occupancy to make sure they can manage stable core staff team, but also ensure consistency and value of money, because it's not based on hourly rate, but on other elements. What providers can do if they arrange any alternative support provision for people, we give them a management fee for up to 5% of the value of the support that they are arranging, so they can manage that better. We expect providers to produce annual reports showing how the ISF has been used and what outcomes have been achieved, and those reports form a basis of annual reviews completed by social workers and a starting point for those discussions. Throughout the implementation of all this work, we have also created a number of guide sheets for social workers, for providers, for relatives, and a basic easy read as well. And we have worked with our finance team to have a reconciliation process to make sure we are transparent and can document how public funds are being used as well, of course, while giving providers the flexibility of using that throughout the year. And where we are now in terms of practicalities and ongoing work is providers themselves created an ISF working group, which is for providers to come together every couple of months to discuss the practicalities of ISFs, bring any questions and queries to the group, talk about good practice, do some brainstorming, and so on. I also attend that meeting, but not as a commissioner, just to learn more and support them and keep that communication and relationship going with providers. Our provider forum meeting takes place quarterly, and ISFs are a standing item on the agenda. So I have one of those forums later today. It's face-to-face meeting, and one of the providers on our framework will be bringing a couple of examples of ISFs to showcase and to discuss with the group today as well. I provide ongoing social work support. As you know, there are changes, constant changes in social work teams and management. So the practice is as good as the knowledge that people have. So I attend social worker team meetings on a regular basis to just bring back some information and help them with any queries they may have. What we do, we are sharing good practice. So if there's any good case scenarios or any providers that are doing really well, they can share those through me, or they can bring them to the forum as well. To do that, we have been exploring how ISFs can be applied in other service areas. So there's a new mental health support framework that covers outreach support as well as supported living, where ISFs are being introduced since May last year, as an option for people to get their support funded by. And last but not least, the challenges. So as you know, we need to be quite clear and transparent how we use public funds. So that's why we are expecting providers to work with us closely if they feel there's not enough money or they are not managing, and with the reporting as well. The risk management was implemented as part of the framework preparation, and where there are more complex cases, we have discussions involving social workers and providers in terms of how that can be best met and how we can fund that. With changes internally, there are also changes within provider organizations, as in new providers are coming on board to the framework every year. And also there are changes within provider organizations when it comes to management. So the loss of existing expertise is something that we have to probably deal with quite often, and revisit the ISF arrangements with providers when new staff are coming on board. It's part of our current monitoring regime as well that we've started. Towards the end of last year, there will be some repeat sessions, if you like, for providers around ISF use, how to report them, how to record them, how to manage them, and some practical support from commissioning perspective as well for it. So that's me done. Whistle stop through our arrangements. If you have any questions or queries, happy to answer.
Thanks, Martha. There was a chat. Oh, we've got Will. I'll come to that. There was a question in the chat, but let's do Will first.
No, thank you very much. Yeah, very interesting talk. Could you expand a little on your core cost model and what's included in that, and how you've gone about sort of benchmarking and taking a different approach? Did you say it's not based on individual hours in terms of your pricing structure? I'd just be interested to hear a bit more about and what you've done on that.
Yeah, I can definitely also share, I said to Chris before, and will say to you, our service specification that describes all of that in greater detail. But in terms of the core cost models, we've implemented them into community clusters, which are, to describe them, it's a courtyard with 6 bungalows. One of them is for staff. 5 or 6 of them are for people who can't share accommodation with anyone else. So they are quite complex. So the core cost covers management, that was costed at the manager fee, and number of staff in a core team that are floating staff. So they can change up with the staff teams working directly with people, and they can provide extra doubled up support, or they can respond at nighttime. We also have technology in those bungalows to help staff with that. We have enhanced concierge, which is block of apartments for people who may need support as and when, but also need individual support. So the core cost covers, again, management, the concierge management of the housing element, as well as 2 members of staff being available on site 24/7, and that was costed at salaried member of staff covering those arrangements. We want to do some work around the core costs within individual supported living, where people share the same house, but that's the work that's just earmarked for us to explore more on. So it might not happen before the next contract. We'll see where we are.
Thank you very much. Very interesting.
Thank you.
Got Jared.
Hi, Marta.
Yeah.
It's just a question about just on one of the slides, you said that you have a framework for ISF providers.
Yeah.
I assume, well, I'm making an assumption, but in general, these like supported living providers.
So it's outreach and supported living care.
Right, and just to follow up on that, then it said like there's a 5% management fee if they source alternate support. So does that mean that the expectation is that the ISF will generally be used on services they provide?
No, so that was our starting point, because what we have done when we started the implementation of the ISF was going out to people who had directly commissioned services and changing the budget that they've had allocated based on direct support into the ISF, but then saying to providers, think about how you use it.
Right.
And look at other options as well. So it was quite heavy in terms of implementation and the first work, I suppose, for the social worker, but then the provider doesn't have to come back every time they want to change something and ask for more. If it's not a change in need of the person, it's just change in outcomes. So they can manage that within the allocated envelope. But that was based on the direct support first. And I have to say, there's a lot of providers who are still transferring it back into direct support because they are not feeling creative enough or empowered enough to try other options. It's quite slow work in progress, I would say.
Yeah, because I mean, Lancashire's current ISF position is that people don't know they've got ISFs because it just goes to the provider and it just goes on their services. So obviously we wanted to redesign.
Yeah. So we are putting more emphasis on providers having an ISF agreement with the person, which is an easy read document, and we've shared some examples that a couple of our providers developed for themselves, saying it's not for you to talk to us, it's for you to talk to the person about what pot of money they have and how they use it. Yeah.
Thank you.
Thank you.
It's Claire next.
Yeah.
Hi, so I'm Claire Anderson from Devon County Council. We have a very small ISF pilot at the moment. which due to capacity issues in-house, we haven't expanded a lot to date. But we are now looking at an options proposal about how we roll that out moving forward. And what you're doing just sounds so interesting. I've got several questions. I'll tell you them all, and then I can go back one at a time if that's okay.
Yeah.
I just wondered how many providers you had on the framework, how you monitor and evaluate the whole ISF programme, or whether you do that through the individual contract management. I wanted to hear a bit more about the broker's role, because I'm not sure if I misheard you in terms of their role, how you call off the framework, and with the 5% fee for providers, how easy that is to monitor and adjust, because that would obviously take quite a lot of monitoring and management in terms of revising the amount that you're paying through to individual organisations. So the first one was how many providers you had on the framework.
We currently have 33 after
you.
the last framework reopening, but 5 of them don't deliver any support.
Okay.
They're just bumping along.
And how do you monitor and evaluate the ISF project itself, or do you do that through the individual contracts and the KPIs?
So when we first started the project, as in the Insights team project, there were reports being done in terms of the budget value as well as the work completed and outcomes achieved by our data analyst. Now it's been since it's become a framework, it's a range of things. So it's annual reviews when social workers are reviewing the outcomes and how the ISFs were spent. We look at outcomes and how the providers are doing through our annual monitoring as well. And ask them to prepare some case scenarios and random examples as well from the work they have done. And of course, when the social workers are going out for the annual reviews, they look at the money spent, and if there's anything that's underspent, there's a discussion about whether it's been saved with a particular view or whether it's just money that's not being used. And then based on that, the budget for the next year is being planned by the social worker with the provider.
Brilliant, thank you. And the role of the brokers, you said they're obviously not traditional brokers, but they work with the individual to plan their support and the providers involved?
So it's the providers who are managing that.
Right, okay, so I misunderstood that, thank you.
Yeah.
And how do you call off the framework? How do you decide which provider is working with which individual?
So we can do either a further competition. So we have 6 lots on the contract currently, and if we require either individual support on the lot 1 or supported living on any of the other lots, it's either for the competition that's ring-fenced to those providers, and we ask them a number of questions and evaluate them as you would contract tender. Or if people want to be involved themselves or the family want to support people, then we ask providers to prepare 1-page statements for people, and they make decision based on that.
Brilliant, thank you. And I'm sorry, I've got these string of questions, but it all comes back to the things I'm thinking of now moving forward. In terms of the 5% management fee, is that not a real pain to monitor and manage as it fluctuates?
It hasn't been to date, so it hasn't been as much change in those that are using different services apart from their own direct support. So even though we expect it to be flexible, it's quite stable, and the flexibility is around the actual staffing support flexing up and down more.
Brilliant, thank you. Thank you very much.
No worries.
Kate?
Hi. So I'm not actually someone who works in a local authority. I'm a mum, and I joined because for 23 years we've been doing direct payments for my daughter, and she's moving out of home. We've brought her somewhere. She's moving out, and my council, I've asked for an ISF and they say they don't do them.
Okay.
So I'm looking for ideas and help about how, and if anyone is here from Cheshire East, it'd be good if they identified themselves, because I did send this session to them, but fairly last minute. So I'm wondering in Newcastle if you do ISFs for individuals, because my daughter's like on her own, in her own place. And I'm asking the council to do an ISF for her. And yeah, how can I help my council to start doing them, basically?
It might be more one for me, Kate, because I guess it's about, I guess that's the purpose of this network. You know, for me, we're trying to help councils get to grips with ISFs. It's not the problem we have, I think, fundamentally, is it's not really codified in the Care Act as something that councils have to offer. It's optional. So we found that it's a coalition of the willing, I would say, on this call. And I think probably the wider councils that are doing ISFs, they're councils that have a particular focus on person-centred approaches, or have a sort of vision where they see the ISFs as being really important to them in commissioning. So it is a challenge, obviously, if councils don't want to interact with ISFs or provide them. I don't think you have much recourse other than maybe going down the complaints process. But I know ISFs absolutely work for people individually. So there's, you know, I think we think there's probably about 5,000 people now nationally that have individual service funds, which is a very tiny fraction of the total number of people that draw on social care. But it is growing. But I would suggest your recourse would probably be to write to the council and maybe try the MP. We did some work. We were at Parliament a few weeks ago because we're trying to raise the profile of ISFs kind of at national level. So we're trying to bang the drum. But I would think MPs, you know, the portfolio holder in cabinet for social care would probably be worth a letter to. But it is a challenge.
That said, that they won't do it. They might be willing. I don't know.
I think you have to ask then. Yeah, I think
trying to get them to be willing, if you like.
Yeah. Yeah.
So I've not necessarily got to really argue about it, but
sure.
Would I be
okay. Yeah.
Talk to you, Chris? Maybe contact.
Yeah, of course. Yeah, absolutely. And feel free to put them in touch with me as well if they want. I'm always happy to have calls from councils that are interested in ISFs to help kick them off, basically.
Thank you.
So please do. Okay, thanks, Kate. Danny.
Yeah, hi. Just a quick one. I'm in a similar position as Kate actually, but I'm in Gateshead. But I think it's you, Chris, that made that map with Citizen Network.
That's right. Yeah.
I've been referencing their own internal documents, and also that because I've got various different data from them that point us to the fact that they do, but they're just refusing. And now we're in sort of loggerheads with we've identified the ISF holder that we want, and we're at loggerheads with them saying we'll do it as a direct payment, but then the direct payment contract has clauses I'm not happy with, so it's just forward backwards. So I think I'll forward via email, but I just find it interesting if we read your map on Citizen Network. Gates would say, yeah, we do, we're in pilot, and they have done for many years, but I'm like, how limited is the pilot? Why aren't we being offered, sort of thing? We've not had any response, we've just had point blank no. So it's just, yeah, I'll catch up after, but I just thought I'd mention that Kate wasn't the only one. And I had a question for Marta, actually, because I'm obviously in a neighbouring town. If I was to move to Newcastle with my disability being mostly primary physical neurological, are they able to offer ISFs to that cohort? I know you were saying that you were primarily learning disability and autism. I am on the waiting list for autism, but yeah, that was my main question. Is there any sort of plans to expand it to physical, neurological, or any wider social care users?
Yeah. That's a good question, because I see how that would be beneficial for other contracts, but that hasn't been approached by my colleagues who are working with people with physical disabilities yet. So that may be a conversation for us to have internally and see how it is. The reason we've looked at mental health framework being provided through the ISF budgeting is because I am overseeing both learning disabilities and autism and mental health sections of our contracting. So that was my experience and my recommendation for us to look at that.
That completely makes sense. But I think not having the flexibility of an ISF is having a detrimental effect on my mental health. So I could perhaps hit that box that way. But yeah, thanks.
Thank you.
I think you raise a really good point there as well around direct payments, and I think so there are examples that we have come across now in some council areas where people have been allowed to hand their direct payment over to a care provider, and then the care provider is then able to use that for a mixture of support hours or other things that person wants to use the budget for. It's just made me think we probably could do with a session on that, perhaps sharing some of those examples, because I think there are restrictions around direct payments sometimes that are just kind of not helpful in these scenarios where perhaps they've been a little bit too over specified. And I think if we could get to a point where we allow people to set their own outcomes, give them a budget. I think the council's job is to give people a budget that they feel is fair and sufficient, and then I think it should be up to citizens to decide how they use that budget. And I think that's what we, as an organisation kind of stand for. But it's just giving people examples really of creativity, and I think there are some out there. But so I don't want to lose direct payments, because I think if you've got a direct payment, to have to switch to an ISF is kind of sad, because you shouldn't, you shouldn't necessarily need to do that. You should be just given the flexibility, with your direct payment to do that.
Yeah, we have a provider who, funnily enough, before we started implementing ISFs on a larger scale, they've done the managed budget for people, so they didn't deliver any support, but they've managed that budget for the person for other things, so as they would with direct payment. But because they were a support provider, it didn't sit with the direct payments team. It was kind of a standalone weird arrangement, but it's working really well for the person, I must say, and we are using this as an example quite often. So if anyone comes to Newcastle and they want to work with new prospects, I would highly recommend them. I'm trying to look through the questions, so I can share any documents that we have either issued as part of the contract or the questionnaires that we've used as part of the tender evaluating as well. What kind of providers we have? So we have national providers as well as local providers, and I must say there's a mixture of how well they are working in terms of the size as well. So we have national providers who are really good, and national providers who are not very supportive towards the local teams, and the same with the local ones. So it's a right mixture of everything. We are also starting to do some work around small business providers as well with ICB. So that's something that will be coming through the pipeline, and I've got the feeling we may use ISFs for those as well to create quite bespoke individual packages.
So Marta, sorry, it was me who asked the question. Would those smaller providers be third sector organisations?
Yeah.
So you haven't started that yet then?
No, we are in the process of putting some meetings together with ICB partners, yeah.
Oh, so it'd be NHS. Would it be NHS then?
It will be joint. It will be joint, yeah.
Joint commissioning between yourself and the NHS.
And NHS, yeah.
Of new providers of so what are the services, the providers that you're currently using? So I'm a third sector, I'm a charity. What are the services? Are they kind of people who are providing residential care? Are they caring organisations?
They are caring organizations, so we have some charity organizations as well as non-charity organizations. Yeah.
Okay, thank you.
I think Dan's got his hand up as well, Martha.
Okay.
Yeah, I think Danny kind of touched on, we meet a lot of people with physical disabilities who feel they don't have a lot of control over their lives. And I was wondering whether there's any work going on to move towards outcome-based funding for people with physical disabilities. For example, getting young people into work and things like that. Did you get that, or do you want a VA to repeat it?
Yeah, so Dan was pretty much just asking
Yeah.
whether there's any outcomes that are being
Any outcome-based funding?
any outcome-based funding for people with physical disabilities.
Yeah.
I would have to check with my colleagues who are working within those contracts. Was my answer is I'm not sure at this moment how it's being arranged and organized.
Okay. Thank you.
Excellent. Claire?
It's actually a question for you, Chris. Do you have a view on why most local authorities, and that might be a bit of an assumption, are focusing mostly on people who have a learning disability or autism?
I think it's probably because individual service funds were, I guess, invented for that group of people, because it was a recognition that often people weren't able to take a direct payment at that point in time because they didn't have a suitable person, or they weren't considered to have the capacity to manage the direct payment. So they were in like a group of people that were excluded traditionally from access to that form of personal budget, basically. Okay. So ISFs, I think, evolved from that, the kind of frustration with the system that people, why shouldn't people have access to that form of, sort of personalised support? And I think that's probably just because it's got a very strong history. That's why I think a lot of authorities focus in on that particularly. There is something though, I think, as we were talking about earlier, that just around actually a lot of people may have a direct payment, and what we don't want them to do is see ISF as like a better option than a direct payment, when a direct payment and an ISF should really be equal in terms of that flexibility. So I think that the key thinking for me sort of over the last few months really has been around what can we do to promote people to be able to use their direct payments more flexibly, and is there a way of creating like a direct payment ISF arrangement so people can hand that off to providers? And there's nothing in the legislation that says you can't do that. It's just about outcomes plus budget, hand it off to an organisation and then work with that organisation to to figure out how to best meet your support goals, basically. So it's trying to not lose sight of that, because I think it is a challenge, because otherwise people see ISFs as this amazing different way of doing stuff that's kind of better. But if you can take a direct payment, or you've got a suitable person, then I would argue that let's extend the direct payments offer and make sure it is, as as Dan was saying, make it more outcome focused, and give people that, allow people to use the budget in a way that makes sense to them.
Thank you.
Dan, did you want to come in again?
Oh, no.
It was a legacy hand.
Yeah.
No worries. Anna?
Hiya, my name's Anne. I'm from North Yorkshire Council. We're currently looking at launching a pilot at the minute with a small number of organisations. And I think for us, well, for some wider teams, some of the sort of worry is around how we're going to demonstrate its success. So I was just wondering about your annual reports, how you kind of measure the outcomes. Is it almost like a sort of care and support review?
Yeah, so it's care and support review by social workers, but what I can do, I can probably share a report that's been published widely in terms of the project work a few years back, so you can see what the data analyst was pulling through in terms of the outcomes and satisfaction and engagement with all the sites. So that may give you some food for thought, I suppose.
Yeah, that would be useful. Thank you.
Yeah.
Brilliant. Doesn't look like we've got any more questions. Just double check the chat, but I think you covered everything in the chat as well, didn't you, Marta? And you're happy to share your spec, aren't you? So if we pass that on to Sonia, perhaps, and she can email it out to everybody with your slides, if that's okay.
Yeah, I'll do that. Yeah.
Awesome. Thank you. Okay, brilliant. Right. Well, in which case, just say thank you very much, Marta, again for your time. And thank you everybody for coming on. Thanks for joining us. And I hope you have a lovely rest of the day. And let's see you at the next.